what happens is that the hypothyroid state T3 and T4 are low, and due to feedback exaggeration, feedback impulses, there is increased production of the thyroid stimulating hormone. Similarly, in T3 toxicity, the T3 levels will be high and the stimulating hormone level will be undetectable. So thyroid gland function, when we get it explained, we see that the thyroxine and triiodothyronine speed up the metabolic rate. They are energy producing hormone. They extract ATPs by increasing the metabolic rate in maintenance of the daily life activities. Now, when there is increased production of thyroid glands hormones, there is hyperplasia of thyroid gland. It is known as goiter. But the goiter is not always the cause of increased production of thyroid hormone. Sometimes goiter is due to the reduced iodine content of the diet, and due to reduced iodine content, there is reduced formation of T4 that will send feedback signals to the pituitary that will cause increased release of thyroid stimulating hormone that will result in hyperplasia and goiter due to reduced iodine content in the diet. Now this is the manifestation, this picture is the manifestation, this goiter is the manifestation of reduced iodine content of the diet, so reduced production of T4 and hypothyroidism. And this picture, exophthalmos, is the depiction of the hyperthyroidism and increased functioning of thyroid gland that can be due to tumor of thyroid, due to increased production from the feedback mechanism from the pituitary, and that can be due to drugs, the iodine providing drugs. One of the manifestation of hyperthyroidism is the exophthalmos, that is outward protrusion of the eyeballs. Now goiter formation का mechanism तो मैंने explain कर दिया. Because of the iodine deficiency in the diet, what happens is that there is low T3 and T4 production and low negative feedback to the anterior pituitary. There is excess production of thyroid stimulating hormone that result in hypertrophy and enlargement of thyroid gland, which is known as goiter. Now this goiter indirectly depicts the reduced T3 T4 production from reduced iodine content, so hypothyroidism. So hypothyroidism have got certain signs and symptoms. The physiology explains it very well, but as far as we are concerned in the biochemistry, it results in bradycardia, cold extremities, dry skin, periorbital puffiness, hoarse voice, and delayed relaxation phase of the ankle jerk. This is very, very important clinical sign. Symptoms include mental lethargy, tiredness, and weight gain, constipation, and menstrual disturbances, and carpal tunnel syndrome. In patients में carpal tunnel syndrome में there is hypertrophy of the ligament that inserts pressure upon the nerves, the median nerves, और हाथ पांव सो जाते हैं patients के. There is a main difference depicting diagram between the hypothyroidism and hyperthyroidism. In hyperthyroidism, due to increased metabolic rate, there is sweating and neurotic anxiety, fine tremors when we insert paper upon the extended hands, strong rapid pulse and cardiac manifestations, and brisk reflexes हैं. LDL लो हो जाता है, डायरिया हो जाता है, वेट लॉस है ड्यू टू इंक्रीज मेटाबॉलिक रेट एंड इंक्रीज एनर्जी प्रोडक्शन, एंड टू सम एक्सटेंट देयर आर कार्डियक मैनिफेस्टेशंस एंड एट्रियल फिब्रिलेशंस. Similarly, in hypothyroidism, there is thinning of hair, brittleness of nails, and dry, coarse, cold skin, big tongue, and cold intolerance. So these are the two forms of reduced production and increased production of thyroid hormones. When there is adult hypothyroidism, it is known as myxedema, and when it is severe, it is known as myxedema. And when there is infantile hypothyroidism, these are the features with short stature, coarse facial features, protruding tongue, umbilical hernia. and these are due to the deficiency in the iodine of the mother's blood and the deficient production of the iodine in the area to which the patient belongs, the pregnant lady belongs. This is the severest form of the hypothyroidism. So the clinical connection of the hyperthyroidism is explained by this: hypothalamo-pituitary thyroid axis, in which thyroid stimulating immunoglobulins are formed which stimulate thyroid gland, and it gets enlarged and it produces T3 T4 in increased amount, and this increased amount gives negative feedback, and there is reduced production of thyroid releasing hormone and thyroid stimulating hormone. So this explains hyperthyroidism due to goiter or Graves' disease, Similarly, in hypothyroidism, what happens is that there is deficiency of iodine in the diet, decreased T3 and T4, and reduced T3 T4 sends impulses to hypothalamus to increase formation of thyroid releasing hormone that increases thyroid stimulating hormone from the anterior pituitary, that results in thyroid glands hypertrophy. And this thyroid gland hypertrophy demands iodine, and when there is no iodine in the diet, what will happen? There will be no formation of T3 and T4, and all the manifestation and the metabolic rates will not be increased. Result will be cretinism. So this explains the formation of the thyroid gland hormones known as thyroxine, and the manifestations and the physiology and pathology of thyroid gland.